Do you know when the vaccine will be safe for children?
The only vaccine trial right now in the pediatric population is in Moderna, looking at 12 to 18-year-olds. There are some younger age trials being planned, but they're not fully initiated yet. The whole thing about the safety of vaccines is going to be tough because we're not going to have long-term data on vaccines because of the acuity of the pandemic. Normally, we would wait a couple of years to understand the safety of vaccines, but we don't have that luxury of time right now. So I guess the short answer is we're going to have to extrapolate some of the data from adults to children, but it's going to be an evolution to understand the safety of the vaccines overall.
How accurate are these tests? How often should people get tested?
So that's a good question. The molecular test itself is 100% accurate in the sense that if there is virus on the swab, when I obtain the sample, it will detect it, period. There's no question about it. What the molecular tests do is they find a portion of the virus called RNA, riboxynucleic acid, and what they do is it amplifies that signal. And the amount of times it needs to repeat the amplification can tell you how effective, how infected the person is. The lower number of cycles needed to amplify, the more infected you are. But it really depends on how adequate the acquisition was. So if I don't get a good sample, you could still be infected and I won't detect it because there's no virus on the swab. And that may or may not be incumbent on the person doing the test. It could also be just the part of your body where I happened to touch with the swab, and maybe it wasn't there at the moment that I was testing. And so there's a lot of nuances. And when we talk about false negatives with the molecular test, it's because we didn't get the sample correctly or because it wasn't there. The antigen tests are a little bit less accurate, and those tests tend to have more false negatives and more false positives than the molecular tests themselves. The antibody tests are very accurate in terms of detecting when somebody's developed an antibody response, but because that takes a while to develop, it's not a good test to tell us if somebody's infected. It's really only good to tell us if somebody's been infected in the past, and we don't even know how long ago that infection was based on the test, but we presume it's at least 2 to 3 weeks prior to the point where you develop those antibodies. So the tests are generally really accurate for what they do, which is, what each one of the different tests does, but there's a lot of variability in terms of how the samples are acquired that can affect the test results themselves.
So most of us, the average person that's going into the doctor's office to get tested, you're getting a nasal swab, right? You're getting the nasal test swab test that takes, 48 to, it was taking almost 7 days to get the results back, or you're taking a rapid test. And so of those two, and then there's the antibody test, of those two, in what you just described, this is again, how accurate are the different tests? Do you recommend one over the other?
Well, the most accurate and the gold standard for detection of the virus is the molecular or PCR test. And that is the one that we want to use to say someone is infected or not, period. And it can still detect the virus after the acute period if it's lingering in your body. It really tells us if the virus is present in your body or not. And with that caveat that if we don't get an adequate sample, it can be what's called a false negative. The blood-based antibody test really should not be used for population-level screening of acute infection, period. We don't do that. Nobody advocates for that. So if somebody's offering you a finger prick test to tell you if you have COVID, that's not the right way to go about it. You can get a finger prick test to tell you if you may have had COVID in the past, but it's not going to tell you you have COVID, you don't have COVID, you're good to go see your family, you're not good to go see your family. Those are the important things that people need to know. And it's also important to remember, that it's just difficult in populations who don't have symptoms to really best understand the test results, because the test results have to fit within a clinical context. If you're sick with a fever and I test you positive, it's most likely a positive. If you're completely asymptomatic and I'm just routinely screening and it comes back positive, you have to look at it and say, is this a true positive or a false positive? Because if there's no likely scenario where you got exposed, you have to question the test result itself. And we've seen this a lot with things like sports teams and movies and all these types of things where they're routinely testing people and positives come up all the time that end up being false positives. So it really depends on, how someone's symptoms are. And I want to touch on one other question. I know we have to get to some other things here, but how frequently should people get tested? I didn't answer that question. The reality is it depends on how frequently you may potentially be exposed and what your symptoms are. If you're symptomatic, you should always go get tested, except for the fact if you've already had COVID, part of the new CDC guidance is don't bother getting tested within the first 3 months after you have a positive COVID test. There's no need for repeat testing after the first 10 days of the positive test because you're infectious for the first 5 to 7 days and then it goes away. You could be positive for a while and it's just a waste of resources to retest you, and B, not useful because it's misleading information that may cause false concern on your part when you're no longer infectious. I'd say the most important thing is that you can't use the test as a surrogate for good social distancing and prevention measures. If you need to be home, stay home. If you can work from home, stay home and don't push it. You don't need to get together with family now. I know the holidays are coming up and it's hard, but just be responsible and be respectful for all of those around you.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.